Live from the Riverwalk downtown, this is San Antonio Living on News 4.
We're beginning with some big medical news, and it's happening here in San Antonio. Could really change the way type 2 diabetics deal with their condition. And it's something that's being tested right now. It's a teeny tiny little implant. We wanted to learn more about that once we heard about it. It's called Tantalus, and we brought in Dr. Mark Kipnis to talk more about how this could really change the future of living with type 2 diabetes. So welcome.
Well, thank you. Thank you.
Okay, this little implant sounds almost like a fantasy because it actually tells your stomach when it's full. And how is that connected? Because I think a lot of people who diet would love to have something like this. How that is connected to the treatment of type 2 diabetes?
Yeah, well, it's a very novel idea, and years ago but medical investigators knew much about electrical stimulations of the heart, and pacemakers are old news. This is sort of a pacemaker for the stomach, and it's a very novel idea. It involves a minimally invasive laparoscopic procedure that implanted into the subcutaneous tissue of the abdomen will allow patients to lose weight and control their diabetes. The major part of this study is to control diabetes, but as a secondary phenomena, hopefully most patients will also lose weight.
And we're seeing what it looks like. It's only a couple of inches tall and a couple of inches wide. And again, you said that that is inserted in your abdomen. And let's talk about how that's done. When you brought some animation to show exactly what's done, and talk us through what we're seeing here.
Well, this is a surgeon who's going to be, I'm not sure where they're going with the next photo, but this is a schematic of the stomach, and the surgeon is now placing the leads of the electrode that are connecting to this pacemaker-like device into the proper parts of the stomach. That's the pacemaker that's showing now. One of the leads is in the early part of the stomach, called the proximal part of the stomach, and the latter part of the leads go into what's called the antrum of the stomach, where food ultimately ends up when a full meal is eaten. The way this device works is that as food is entering the stomach, the electrodes tip off the pacemaker that food is entering, and the pacemaker gives a signal to the end of the stomach, to the other leads that we saw just placed. And so patients and the body thinks that a full meal's been eaten. And so even though a full meal has not been eaten, the pancreas somehow senses that a full meal's been eaten, and whether insulin's released or whether the insulin seems to work better, we're not clear on, but blood sugars seem to improve when this technique is used, and so electrical stimulus to the stomach seems to improve diabetes control. This is almost an epidemic in San Antonio, as you know, and it's a horrendous problem. The death rate in San Antonio for diabetes-related deaths is about second to New Orleans, and that's of the 54 largest cities in the country. We're second in terms of diabetes-related mortality, and so it's a horrible problem here in San Antonio. Worldwide, it's a terrible problem. Obviously, about 2.8% of patients worldwide have type 2 diabetes associated with obesity, and is growing at a rate of about 5% a year.
Right now, we're seeing an image. What is this?
There's the one on the smaller one is the device that's called the patient wand, and it's the device that allows patients to turn it on and off this device.
Do you have to wear that all the time?
No, it's carried, in a purse or somewhere else. It's radio frequency waves turn on and turn off the pacemaker part of the
And that's what's
device.
implanted. What is your hope with these clinical trials down the road? What do you think will happen with this device?
Well, it would be wonderful if a patient could have a minimally invasive one-time procedure and control their diabetes and their weight, as opposed to what we have now, which are multiple medications, and sometimes patients aren't very compliant. It's difficult to take medicines at various times in the day, and so it might be one of the many ways that we're always trying to So it'd have a better mousetrap, and we have lots of room to improve in how we take care of type 2 diabetic patients.
Because a lot of times you hear about people who are obese and who lose a substantial amount of weight, and then they no longer have type 2 diabetes and some of the other complications that go along with this. And so that's where the connection is between the weight loss and, of course, this device. And in the patients you've already implanted, what kind of success have you seen?
Well, we've seen a fair amount of success both in diabetes control and weight loss. They don't always correlate, which is surprising to me and some of the medical community as well, because as you said, if patients lose enough weight, their blood sugars improve dramatically, and it's estimated that if patients lose 10% of their of their body weight when they're obese, their insulin requirements dramatically fall, and they can sometimes be taken off insulin. But this particular device, in the studies that have been done, some patients don't lose as much weight and have better blood sugar control, and some patients lose a lot of weight and don't have sugar control. So it doesn't really correlate one-to-one.
Well, let's hope that the clinical trials go well and that this is something that will help folks down the road in the future. Thank you so much for coming by.